In this video, we're talking about a recently published peer-reviewed paper exploring patient and public involvement, also known as PPI, and co-production approaches in mental health research, learning from the PARTNERS2 research programme. This is based on work we've done in a mental health trial across several sites in England. We've worked in Plymouth, Birmingham and Lancashire, and more recently in Cornwall and Somerset as well. The aim of the PARTNERS2 study is to develop a new system of care for people with ongoing mental health needs, including bipolar and psychosis. This paper deals specifically with how we went about building respectful and trusting relationships across a large multidisciplinary team, and how we communicate with each other, how we involve people in decision making, how everyone's expertise was drawn upon and valued, and importantly, how service users and carers were involved as equal partners in this process.
We all wrote together as a collective on the paper because we'd all kind of contributed with our own lived experience, and I think that was a really good way of developing the paper, with all doing our own bit towards a project. It's normally quite unusual for there to be no lead author from my experience. So this was quite good that we'd all were listed as a contributor, as an author. And I felt it was quite important, given that the project was around PPI and the importance of developing PPI into a research project.
I think researchers can best provide a space for emotional work through a couple of things. I think the physical environment matters. If the physical environment is right, it will, that then energy and thoughts can flow. Also, I think, which is really important, is to be amongst a group of people who share the same values, share similar values, so that we can be in a respectful and supportive environment. How best can researchers support us is by asking us, just ask us, do you want some space? Drop me a line, call me. So not to make themselves available 24/7, but just so that me, for example, would know that if I was struggling with something, I can contact somebody. So I am aware of my emotions that sometimes emerge because we're talking about sensitive issues. When I say sensitive, I mean personal to me. Wading my way through the mental health system is, can be tricky, can be tough.
Well, I joined the PARTNERS2 study program as a member of the LEAP in Birmingham, because they wanted people who had particular diagnoses that were the same as the client group we were going to recruit to the trial. And I had a diagnosis of bipolar. So that's how I became part of the LEAP, which is a lived experience advisory panel. After a year, I became a service user researcher, which was a role that was specially created within the PARTNERS2 study. It's something that involves someone using their own lived experience to bring something extra to the research role.
Because often patient and public involvement or co-production is very much seen as bringing people into a study for their expertise in a certain way as advisors, placed on a committee, working alongside academics, but not being in the academic team as such. And I think one of the really interesting things about the Partners programme and the design of it is that We started with 3 service user researchers, 1 in each of our sites, and we started also with 3 PPI groups, again 1 in each site. And over time, these roles at some level merged, but also we got to learn a lot more about what it was like to be a PPI advisor on the project, and also what it was like to be a service user researcher. And we also had researchers in roles that didn't have that label as a service user researcher, but people were using their expertise by experience of poor mental health in their job. And we've tried to explore in the paper how we went about resolving some of the tensions that might arise in teams around some of these roles, these role distinctions.
The difference between the 2 roles, being a LEAP member and being a service user researcher, are that service user researcher isn't exclusively dealing with lived experience. I also got very much pulled into looking at things that any researcher would do. Where the service user lived experience aspect comes in is, for example, maybe in recruitment, where I've been out to recruit participants, and when I'm telling the story of Partners2, I always tell them about the LEAP and the fact it has lived experience of mental health issues involved in it. And I'm sort of there as living proof of that, because I mentioned my diagnosis. It kind of flows quite naturally. And I think it helps to have someone who's there that they can identify with.
The value of service user researchers, they are worth their weight in gold because they provide a bridge between us and them. And I don't like to say us and them because in many ways we're not, in some ways we are. So I'm talking about LEAP members, service users and carers, and then the academics and the service user researchers provide that wonderful, I think, a safety net in many ways. I think they do an amazing job.
The reason why I'm involved in Partners2 research is because I've always been very passionate about mental health. And I think research is a way of bringing changes that improve people's lives through evidence that research gathers. And I feel very honored and privileged that I'm able to contribute from a service user perspective and carer perspective as a PPI contributor in a lived experience advisory panel. And it's a place for service users and carers to have a stake in the research, but also to be kind of a voice and give a different perspective to academics and clinicians.
I think a lot of people are using co-production in their research practices, but not that many people have written about the nuances of doing it and the practicalities of doing it. And having worked with this amazing team for the past 5 years and seeing some of the complexities of doing it, it really felt that it was important to kind of put that out into the literature and show from our experience some of the things that we'd found that hopefully operationalise some of the kind of principles and values and concepts around co-production, but actually see how that might be applied in practice. And it's been a really rewarding experience working with the team on trying to get our thoughts together of what we thought were the most important things to say, because there's so many things to say. So the paper is a flavour, it's a point in time of our experiences, but we do hope that it's helpful for others to see some of those things.